Hey everybody, Dr. Caitlin here with FitPT. Today I'm going to show you an exercise that really helps to work not only hamstring flexibility, but also to mobilize and move and stretch through the sciatic nerve. Now, when we're talking about nerves, any nerve in the body, we have to remember that our nerves are not as stretchy as we like to think that they are. So when we think about our muscles and our tendons in our body, they're like a rubber band. They love to be pulled apart and stretched, and that feels so good to them. But when we're talking about a nerve, and we're going to talk about the sciatic nerve today specifically, we have to think about our nerves more like a piece of string or like this strap here. You really can't pull them apart, and they really don't like that. So with nerves, we actually like to use the term flossing or gliding instead of stretching, because again, nerves don't like to be pulled apart. If I pull on one end, it's kind of like a tug of war, or literally like you're flossing your teeth. There's like a give and a take because it doesn't have the stretching components that our tendons and our muscles do, okay? So when we are doing this next exercise, it can be twofold. It can be used certainly as a form of hamstring stretching, but I would also keep in mind how we're doing this kind of on and off technique with the stretching, and that is going to be really great for your sciatic nerve. So this is given to most of my clients who have a history of low back pain or hip pain or sciatica. If they have any sort of neural tension or symptoms like a tingling and numbness, radiculopathy coming down the legs, they often get this exercise, so this may be you. So I personally am going to use a yoga strap today, something that has a little bit more support. At home you can use a dog leash, you can use a rope, you can use a couple belts clicked together, anything of that sort. I've even had patients use a towel. It can be very basic. So go ahead and flip on over to your back. Bring your strap or device with you. And before I lay down, I'm actually going to place the strap on the bottom arch of my right foot. Okay. So the strap is held in each hand, and I'm going to bring my elbows down to the mat space. I find it gets a little hard to hold and navigate with your arms in the air, so just go ahead and find a comfortable space where your elbows can be in contact with the floor or the bed. So from here, I'm going to find a 90-degree roughly bend, and then I'm going to start to kick my leg up to straighten it. Now I have pretty good flexibility, so I can get to almost straight. For some of you, you may just kick to here before you get your hamstring stretch. Okay, now you're going to hear me use the word hamstring stretch a lot today because that truly is what you're going to feel. You're going to feel a stretch somewhere along the back side of the leg. Now, don't be fooled by me saying that because we are actually mobilizing the sciatic nerve or flossing or gliding the sciatic nerve when we're doing this. So mobilizing, gliding, and flossing are all synonymous terms for working on nerve mobility. So don't let me confuse you with that. So I'm kicking up, stretch on, stretch off. Stretch on, stretch off. Notice I'm not holding very long, okay? What the sciatic nerve or the nervous system in general doesn't love is when we hold a big stretch. Okay, so especially if you're flared up and you've got neural tension or sciatica symptoms, we do not want to hold the stretch. All right, so I'm really just flossing, kicking up and down. Okay, now that's feeling pretty good to me. All right, now I'm gonna find just like a mediocre stretch, nothing crazy, because again, we wanna be gentle with it. And now I'm going to point and flex my toes. So the sciatic nerve runs down the back of the thigh like a big ropey system. And then when it gets to the knee, it splits off into smaller nerves. And so I'm gonna move my foot up and down to still continue to mobilize the lower or distal ends of it, okay? And this feels more like a calf stretch to me. I still get a little hamstring feedback. I can always take a break and rebend and come back up. And then the last one here, I'm gonna go in and out. So I'm just rolling my foot in and out, almost pretending like I am gonna give myself an ankle sprain. Most people know what that mechanism looks like when you invert or turn the foot in. So we're not actually gonna do that, but we're gonna turn it in, turn it out. Turn it in, turn it out. If you like, you can always do circles, whatever feels good, okay? Give yourself breaks as you need to. Now, ideally, you would spend a good like 10 10 to 15 repetitions of each of these. So we've got the knee pumps, the ankle pumps, the ankle ins and outs, and the ankle circles, okay? So that's a lot of repetitions on each leg, and we know that if we want to actually make really good headway with our nervous system and improving our nerve symptoms, we actually have to do at least 30 reps, which is a lot. So I kind of just go from each body part, give it a good 15 repetitions in each, and we easily cover that minimum. All right. So by the end of that, if you do have quite a flare-up of nerve symptoms, you may notice it actually gets easier and less aggressive the more you do. The other thing to take note, my left leg, my opposite leg is straight right now. For those of you who are struggling with low back pain or high symptoms, you may want to consider bending that leg and that knee and just placing your foot on the ground. It just takes a little bit of stress off your back, okay? So that is how we can do sciatic nerve glides. Using a strap, a belt, a dog leash, whatever's convenient at home. Lots of repetition, very low load. It should not feel like a stretch that you are cringing and biting your teeth through. So just feel like it's gentle and just lots of little on and off stretches there. All right, you guys, if you like what you see here, be sure to subscribe to Your Fit PT on YouTube. We will see you back here next time.